This is a question you all ask me all the time in clinic. Are weight injections safe? Are you confused about your weight? Do you have questions about weight medicine and you want medically based answers to your weight questions? If so, you are in the right place. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. Today, we're going to talk about a question I get asked all the time in clinic, whether I've been seeing a patient for a long time as their PCP and they want to talk about weight medications, or whether I'm just seeing them as their weight medicine physician. A lot of people have this question, and that is, are weight medications, are injectable weight medications safe? So overwhelmingly, the answer is yes for the right patient. So I know a lot of patients are cautious, rightfully so, about starting a weight medication. Not only is it, it's a big commitment in terms of time, potentially money, just being on something for a long time. And they have concerns because there have been weight medications in the past that were taken off market, rightfully so. They were not safe for patients to take long term, and we figured that out later. So a lot of people are concerned about starting something new because because they've heard about weight medications in the past that have been taken off the market. And also, I would say, there is a lot of sensationalist news and things in social media about the side effects of weight medications, and some people really can have terrible side effects with these medications. So I'm not going to sugarcoat it. Some people do not do well and they can have very serious side effects, but that is the case for all medications. All medications, regardless of what you're taking. If you're taking ibuprofen, there are serious side effects that can happen with that. So just like any other medication, the weight loss injectable medications also carry their own list of very serious side effects. And that is another reason why you really want to make sure that you are talking to a trusted physician about taking these medications and that you have appropriate follow-up in place to occur as you are taking them. But I will say, overwhelmingly, the truth is that usually these have what I would say are annoying but manageable side effects. And I've made a whole playlist of medication side effects, so you can definitely check that out. And also, because there are so many people that are taking these now, we're going to see some of the more bizarre, rare side effects that we might not have seen when it was just 10,000 people taking it. And when we have millions of people taking a medication, you're going to see more of these outliers that arise. Also, just to go to the total opposite end of the spectrum, some people, I think because we hear about them a lot, have kind of a very casual approach to these medications. And I would say just because we hear about them a lot doesn't mean that they're the right medication for you or that they should be used casually. Like any medication, you really want to make sure you're getting it from a trusted physician and that you've been able to ask them all the questions you have and be able to go through your list of concerns. And it doesn't mean that we should be prescribing these medications or taking these medications casually. And you all know also how I feel about compounding medications or the compounding these injectable medications. I don't think it's a good idea, and there are lots of side effects, and I've made videos about that as well. So just because you hear about them a lot doesn't mean they should be taken casually. You definitely want to talk to your prescribing physician about them. Make sure you're getting all your questions answered and make sure that you have a reliable follow-up approach in place before you start them. So the bottom line is when these are used responsibly, when they're prescribed responsibly, they can be a really helpful tool for helping people lose weight, and they can also really help with preventing weight-related complications from occurring in the future or from even starting. So that's going to do it for today. Thank you so much for watching. As always, if you have questions afterwards, you can definitely leave them in the comment section down below. If you want to work with me directly, I'll leave that information down below. Like, subscribe, do all the things, and please be well.